It's not just one or two countries we're talking about. We're talking about millions and hundreds of millions of people. So the scope to help is absolutely tremendous. So Teleheal is an international telemedicine charity through which medical specialists from the NHS in the UK, rest of the Europe, from America, from Canada and Australia, they provide life-saving advice on smartphones using encrypted social media to medics in conflict zones and in low-resource countries. I founded Teleheal back in 2015, and to give back to Afghanistan, a country where I was born into war, and I spent the first 15 years of my life in conflict and in refugee camps. So I had seen and I had experienced the suffering. People in low resource countries, they still don't have access to medical specialists. Since the beginning of the pandemic, in partnership with the Ministry of Public Health of Afghanistan, we created a dedicated COVID-19 group through which we've recruited up to 250 medical doctors throughout Afghanistan, all provinces, including Kabul. They're talking with the medical specialists from the UK and rest of the world. They cover emergency medicine, intensive care, acute medicine, as well as mental health. And the system works on 24/7 basis. So it's live anytime they have any questions they can ask.
Our doctors in Afghanistan, most of the doctors, they have not opportunity to training and to resources because of war. So this is very important, this telehealth program, to support our doctors training, and also upgrade their knowledge and save the life of many people of inside Afghanistan. Because of the COVID is a newly virus, our doctors are not be able to deal with the treatment of that coronavirus. So on the telemedicine or telehealth partnership is very important for our country.
I'll get pictures sent of ventilator settings and waveforms, and give advice on optimizing settings there. They've been asked about medication to treat COVID-19. It was a patient who presented with shortness of breath, cough, fever, diarrhea, and anosmia, loss of smell, which, you know, are typical symptoms of COVID. But they had a negative initial swab. Their oxygen levels were very low, and Dr. Hemat sent me over the observations, how the patient felt, the x-rays and blood investigations.
After 14 days, she became worse and find dyspnea, chest pain, and some body pains. We started the treatment by close contact with them.
Very quickly, the X-ray was looked at by one of the consultant radiologists who's in the part of the charity, and a report was given. I had a look through the blood investigations and summarised them, and offered a suggested management plan and advice around treatment, particularly around retesting for COVID, even though the first swab was negative, because there have been cases where the first swab has been negative, but then subsequent swabs come back positive.
After a few days, the patients become health and discharged to home. It is the big problem in the diagnosis and treatment of the critical cares, the critical illness. If the treatment is starting in the first times, it is chance is more than it is started late.
COVID-19 has also impacted the mental health of almost everybody in the world. Contributing factors they include the unpredictability of the virus, the compromises made with social contact, the fear and the trauma of seeing loved ones die, and in the case of healthcare workers, seeing their patients suffer and die. So they have contributed to mental health issues such as stress, anxiety, depression, and PTSD. And in the community, the issues that have been created by this pandemic, they include stigmatization and discrimination of patients suffering or suspected cases of COVID-19, domestic abuse, as well as the uptake in the substance and alcohol. To create or replicate the system, it doesn't require too much of complex technology or a lot of money, but it does require a lot of commitment, a lot of dedication, and a lot of compassion, which our colleagues have shown on both sides.
Being able to help our colleagues in Afghanistan learn from our experiences has been very rewarding.
I hope to keep their support with us. It is very important for our patients.
Important innovation in conflict zones and in low-resource countries consists from simple technology, combine that with the compassion and the solidarity of humans, that they can stand side by side each other and they can solve a problem that's continuously evolving, such as COVID-19.